So in our series of testing composites for voids and gaps after we use the compressed composite technique, we are now working with the Tetric Evocream. Yes, the Tetric Evo bulk fill. So this cavity that we have repaired is about 6 millimeters against this axial wall, about 5.5 to 6 millimeters on this wall, and the occlusal box is about just right at 4 millimeters, maybe a little more, depending on the cusp heights in different areas. So once again, we're just going to go with our bulk fill, one bolus placement, and let the compression technique do the rest. As you can see, this cavity is so big it took a whole carpule. Like to wet the beak a little bit with some alcohol or bonding agent and literally just press and press. And on a cavity like this, you can also place it sideways and away. For the way this instrument comes is you have this tip, the metal tip, upon which we slide on the silicone compressible tip, which really helps us to compress the composite into the cavity. So now we are going to cure it. Usually we'll do 20 seconds from the occlusal, and in the mouth we'll do 20 seconds from the lingual, 20 from the facial. In this scenario, obviously this is a typodont tooth. So I can show you the position where I would place it. It looks like it's pretty well cured, and it doesn't appear to have absolutely any gaps or voids there. And we can check with our Explorer as well. And just to kind of show you the position, you would go from the outside a little bit like this, using the translucency that natural tooth would give you. This obviously is not going to be as translucent as a natural tooth, but you can see the concept. You could do the same thing on the other side. The walls in a cavity like this are going to be so thin, the buccal and the lingual wall, that you'll actually get quite a bit of penetration through of the light through them down into the composite. And really a tooth like this should be getting a crown, but you know, to make a point here for the compressed composite technique and how well it helps the curing process and how well it helps the adaptation of the material to the cavity, we're using these large cavities that were prepared. And also we will do a sectioning of this tooth to evaluate how the composite is at the base of this cavity in the deeper crevices. So thank you.